Action News Now reporter Tori Apodaca is live now at the hospital. So Tori, how is Enloe handling the Omicron challenges?
Well, Alan, the staff here at Enloe are doing what they can to protect themselves and continuing to care for patients. But even with the precautions that they're taking, a lot of them are still out sick with COVID. It's not just more COVID-19 patients in the hospital, but now more staff are coming down with the virus too.
Healthcare professionals are people too, and we can get sick also.
Earlier this month, the California Department of Public Health said if healthcare professionals test positive but are asymptomatic, they can return to work with an N95 mask. But Enloe says they're not making sick people come to work.
At Enloe, if somebody tests positive for COVID now, they're taking care of themselves and staying home. They don't have to come in and work.
They're doing what they think is best, and so that's all they can do, is what they think is best.
Because of the amount of staff that's out sick, they are calling in travel nurses to fill in the gaps.
I think everybody wants it to end, and it's emotionally and socially draining when you can't go do and be out.
Chief Medical Officer at Enloe, Dr. Marcia Nelson, expects Omicron to peak in early or mid-February. Even though a lot of staff is out sick, she says they are prepared.
We're not out of ratio, meaning we have the right number of nurses taking care of the right number of patients.
During the Delta surge last summer, Enloe had more than 100 patients in the hospital, compared to the 40 they have right now.
It's not that way with Omicron, thankfully, because we're seeing record numbers of patients at prompt care, for example, with COVID, but fortunately most of them can go home.
It's impacting everybody. I mean, my family's been impacted, lost friends, and it's just really a difficult time for everybody.
Yeah, and right now, 52% of the patients that are hospitalized at Enloe are unvaccinated. Back during the Delta surge, that was 80% of the patients that were unvaccinated. Dr. Nelson says this is because the Omicron variant is more infectious. She does say that the best way you can protect yourself is by getting your booster shot. Reporting live in Chico, Tori Apodaca, Action News Now. Coverage you can count on.
Thank you, Tori. And Enloe tells us that the required isolation for staff who test positive for COVID can vary from 5 to 10 days.